Welcome to How to Take Blood Pressure Accurately for Your Health by Health After Retiring. On this channel, we're all about health and wellness and how to get there, stay there, and how to improve it if you're having problems. And having high blood pressure is a problem I've experienced and I'm still working with. I found out last September, beginning of September, that I had high blood pressure, 180 over 110. So we want to be able to take our blood pressure accurately. It's important to be able to monitor your blood pressure accurately at home. And so you need to have the proper equipment and the place to do it. And so we'll start about the equipment, which is actually pretty critical. You want to get a blood pressure cuff that's the right size for your arm. And so you need one of the tapes that bends. And you want to measure your arm, and basically you need to know what the circumference is around your arm so that you can find the right cuff for your size. Now, a lot of the cuffs out there, they use just one size and it may not fit everybody. If your arm is too small, you may need to go to like a smaller, even what's called a child's cuff. Uh, Sometimes they don't necessarily have a small one, but they have what's called a child's cuff, which is designed for smaller arms. If you have an arm that's bigger than what the cuff is designed for, then you're going to have to go to a large, extra large size cuff to make it fit. Otherwise, you won't get accurate readings. The actual cuff size is very important to getting accurate readings. So you need to measure your arm and check the cuff that is with the monitor you buy. I actually use the Greater Goods monitor 602, and I like it for a lot of reasons. We talked about that in the last video, but it allows me to have what is a cloth cuff, which I like much better because when you put the cuff on, you need to get it snug. And with the D-ring, most of the cuffs out there are nylon, and so they have a tendency to slip as you're trying to get them around and fasten them. And the cloth cuffs don't slip when you tighten them, so they stay snug. You need the cuff snug when you put it on, okay? That's an important issue. So you basically need the cuff, you need to get it on snug, but you also need to get it in the correct position. And the important thing here is this, okay? That tube coming out of the cuff should go right down the center of your arm. They will tell you with some kind of red thing to put it on the major artery, and it's always sticking way over to the side. And the artery we're actually measuring is in the center of your arm. And so that's where this needs to be, right in the center of your arm. And it needs to be placed just above the elbow, above the crease of the elbow. We don't want to go too far above it. We need to keep it close. But basically, that's the position, is get your cuff on and get it close to the elbow crease so that you can take an accurate blood pressure. So the next step is before you take it is really important, is you need to be seated and you need to have your feet flat on the ground, and you need to be seated for at least 5 minutes before you're taking blood pressure. Now, here's an important issue. If you've just eaten, you don't want to go take your blood pressure. If you've just had alcohol, you don't want to go take your blood pressure. If you've just exercised or exerted yourself, you don't want to go take your blood pressure. You want to be at rest. And especially if you've done these other things, you need to wait half hour to an hour before you're taking your blood pressure. So once you are seated with your feet flat on the ground, you need to be seated for at least 5 minutes. It's important, 5 minutes or longer before taking your blood pressure. Now, another critical part to this is that you want to be in a relaxed environment. You don't want this to be noisy or something that's going to have you excited type situation. So you want to be in a comfortable environment. And when we take our blood pressure and we're seated, we want to do it with our arm out to the side at the same level as the heart. You don't want it hanging down. That will increase the blood pressure. So you want to be sure that you get your arm, like what I'm doing is sitting on my couch so that I can lay my arm on the top of the couch. And that allows me to rest my arm. You want it on something that you can rest it on, and you don't want it really hanging down or being low. So your arm needs to be at the same level as your heart. That's a vital factor that is often overlooked. Even in some doctor's office, they will take your blood pressure with your arm hanging out, and that's not correct. Okay, you can look it up on the internet, but it's just not correct. So basically, those are the main steps in taking an accurate blood pressure, and you need to do this consistently. If you have high blood pressure, I would even take it several times a day, which is what I do. If you don't have high blood pressure, I would still take it regularly, maybe once a week or so that you can monitor if you are changing. High blood pressure is a major risk factor for heart disease, stroke, and other health problems. And by taking your blood pressure accurately, you can learn to manage your blood pressure and reduce the risk for these health problems, which is what I'm doing. And recently my blood pressure was up a little bit, and I've figured out, I think, most of the reasons why. And it actually wasn't something I would have normally guessed or thought of. Cherries came into season, and I was eating cherries every day. And it appears like there's something in the cherries that my body was reacting to and driving up my blood pressure. So I got off the cherries, and I'd also done something else. And even though getting off the cherries helped a little bit, it didn't bring it back down where I thought it should be. And I found out that had just started a supplement recently that was a nutritional yeast-based supplement. And it's supposed to be very good for you. It has all the B vitamins and all this and that. But anyway, my body wasn't liking the yeast or something along those lines. So I had to get off of the nutritional yeast, even though the yeast is inactive because they heat it out. It's not an active form of yeast, but basically my body wasn't agreeing with it. I got off of it, and my blood pressure has been coming down each day since I've been off of it, and we're getting back to the 120s, maybe low 130s, over low 80s again, which is where I was in the 120s or 80s before it started going up, and I got into the 140s even over 90s sometimes. So little things can sometimes mess you up, but if you're taking your blood pressure accurately and you're watching what's happened to it, you can kind of backtrack if you need to and find out if you changed your diet or your supplementation, and be able to try to determine maybe I need to change this or stop this or do something a little different, which is one of the tools I'm using. I use a couple of different tools to help me figure out what's going on and what I needed to change, which is why I've been able to go from 180 or 110 back into the 120s over 80s most of the time. And so when it does go up, I'm able to start looking at some factors. And I got another tool I use we'll talk about in a different video. But being able to take your blood pressure accurately for your health is very, very important. And I really hope that you've learned something from this video and you'll start taking your blood pressure accurately. We all need that, especially as we're getting older. So thanks for watching how to take your blood pressure accurately for your health, and we'll talk to you in the next video.